Mr. Garcia,
Yes.
how can you watch the videos that you record?
Just a second. Let me turn this. What was it?
How can you access the videos that you record like right now? How would you access them?
Hold on. I can barely hear you because I got all this running low here. Hold on. You said how to access the video or what was it?
Yes, how do you access the videos that you're recording?
Oh, okay. I let's see. Which one do you need to access?
Like, for example, the one for today.
Okay. Um, I can send you the link to it.
Okay.
I'll send. Are you needing to leave early or something?
Well, I don't, yes, kind of, because my aunt decided to make plans without, like, updating me first because of school.
Okay.
And, she told me that she was off, and then she said that we were making plans to go to this, um, basically throw this video party at, um, her, her boss's house.
Okay. No problem. What time are you gonna be leaving?
Um,
Or I mean, what time are you gonna be leaving this class? Is what I'm saying. That's all I need to know. Or were you gonna even be in here or not?
Probably not. I'm so sorry for the inconvenience.
Oh, it's okay. How about the others? Have you heard anything on the others?
Skylar just joined, but I
Okay.
think Mo will be in soon.
Okay. That'd be good. Yeah, I'll send you the link as far as uh, the recordings. I'll send you the link to it, and you can.
Okay. Thank you so much.
No problem. You have a good day.
Thank you, you too. Bye bye.
Thank you. Bye. All right. Morning, Skylar. All right. So it's 9 o'clock. All right. I'm gonna go ahead and start. I've already started recording, and I'm sure Mo will probably pop in here in a little bit. So a couple of things I want to go over. We're starting chapter 19 today. Just to make sure tomorrow you are prepared for the test when you come in. It's going to be over chapter 1, and you can get into um, review um, chapter 1 on the Quizlet here. Skylar, just make sure you have all your stuff in. As far as chapter 1 homework and stuff, if you can bring that in, I can grade it for you, and I'm making give you extra time to study if you need extra time to study, and take it at a different, maybe like the next day or something. Um, Also, chapter 16. Let's go back over here. Okay, but just look over the videos and stuff like that that I've sent you as well, Skylar, just to so that you have that for review and whatnot. Well, when you come in tomorrow, you're going to come in tomorrow, right? Okay. Yeah, we'll catch you all up and everything. And have you done any work on any of the homework? Okay. For the most part, hopefully, I mean, just spend a lot of the time today to catch up on chapters 1, chapter 16. Um, you have been able to access, you're able to access the videos, right, that I sent you. Okay. Um, yeah, check now, see if you're able to access them, and we'll go from there. But for the most part, we've gone through already. We've done chapters 1 homework, chapter 16 homework, and chapters 2 homework actually. So yeah, there's a lot of catching up to do here for this week for you. Um, we're starting chapters 19, or yeah, chapter 19, musculoskeletal medications, and that we should have a test on that sometime next week. Hmm, okay. I'll send it a different way. Not for sure what the issue is on that. I'll see if I can send it a different format. Maybe put it on YouTube or something, and if see if you're able to get it by that. I won't be able to do that till after I'm done here with the lecture. Good morning, Mo. Just to recap of what I've said. Chapter 1 test tomorrow. Chapters 16 test on Wednesday. Skylar will work with you, see about catching up on everything. Um, let's see. Well, I did put up the quizzes that I went over last week. And again, Skylar, you can get into your, unless you want to come today, come by the room today to get your books, and say about 1 o'clock. Yeah, about 1 o'clock could be all right. I mean, if you want to stick around, that's fine. Or if you want to do the online thing and leave at your house, that's fine as well. Well, no, let's do it. Let's. Are you able to come by? Let me ask you: are you able to come by the the school today, Skylar? Okay. Um, Let me get you your books today. So come by. How about, are you able to stay from 1 to 3 today, Skylar, in here? Okay. Yeah, so we can get you all caught up and everything that you need to get caught up on and stuff. So you're going to be busy. All right. Yeah, come in by 1 o'clock, and uh, I'll catch you up on everything as well. Okay. Let's open chapter 19. Follow along with in y'all's books as well. As I go through this PowerPoint, chapter 19. Go into assignments. All right, so here's your downloads for the worksheets if you want to get into it. I'm about to get into the PowerPoint. This is the musculoskeletal meds. Stuff that you would have. This is what we're going to be tested over. So I will probably ask a question. What is the brand name to acetaminophen? And then you'll have to. I'll have it'll be multiple choice, and you'll pick the right one. Or I will. What's the drug classification to acetaminophen? Actually, the drug classification to acetaminophen is analgesic. I don't know why they got these as far as this one uh, mixed up. This the indications are for mild pain and fever. So I might ask the question, what's the drug class for acetaminophen? And you would pick analgesic. Or what are the indications for acetaminophen? And you would put mild pain or fever. It's also good to know the types of side effects it has. In your book, it has certain side effects. We'll go over that as well. Also, this area right here kind of tells you the kind of side effects or what not to do. Auxiliary labels are labels that we put on the prescriptions just to warn the patient what to do and what not to do. So this one says, ask a doctor or pharmacist before using any other medicine that may contain acetaminophen, because acetaminophen really affects the liver, and you don't want to overdo it on that. So um, Tylenol has been uh, taken off the market because it does affect the liver pretty bad. So they they've had recalls in regards to that. It says taking too much acetaminophen can lead to a fatal overdose, and that's usually, I believe, either 2 grams or 4 grams. I can't remember, but fatal dose is either 2,000 milligrams or 4,000 milligrams. So that would be pretty bad. It says avoid drinking alcohol and may increase your risk of liver damage. So again, Tylenol does hurt the liver if you do take too much. We'll go down to this next one here, alendronate. And with the alendronate, we kind of have to put that we'll put that in the drug class of biphosphonates. And the indications is for osteoporosis. So you might have a question. What's the generic name to Fosamax? And then I'll have a list there for you, multiple choice, and you'll have to pick the right one. So for the most part, like what I've been telling you in regards to drug classifications, there are some drugs that have the same ending. This is one of them. So you have biphosphonate. So we have alendronate. So the drug class for alendronate is biphosphonate. So kind of look at the suffix and make sure that that they are the same. Not all drug classes will have the same suffix in them. This one just happens to have it. Also, you might have uh, a question of what's the indications for alendronate. So you'll have a list of, is it analgesic? Is it for osteoporosis? Is it for mild pain or fever? Stuff like that. So those are the type of questions you'll see. Then you got all these other ones. Drug class for allopurinol, xanthine oxidase inhibitor. It's used for gout and chemo related. For the most part, I just really want y'all to remember that it's mainly used for gout. Um, what's the brand name or what's the generic name for Xyloprim? Of course, you'll have a multiple choice of A, B, C, or D you'll pick. And if allopurinol is in one of them, then you'll pick that one, of course. Um, always look at these auxiliary labels. I'm not too much focused on the recommended daily dosages. You'll learn that when we're entering medications and transcribing prescriptions and stuff like that. So I'm just trying to get y'all used to or familiar as to what kind of questions to look for or what to uh, what to study over. And you have more here. Um, like this drug class is is an NSAID or salicylate. It's also an NSAID for aspirin. And so if I have a list of, I'll probably say what's the generic name for Bayer, or what's the generic name for Ecotrin, and then you'll have to list. You'll see the list and pick the correct one. Of course, this one's aspirin. Or what's the indications for aspirin? It'll usually be for pain, inflammation, and fever. Don't get this mixed up with acetaminophen up here. This one's just mainly for mild pain and fever, no inflammation. So Tylenol is not for inflammation. Only the NSAIDs are for inflammation. So kind of keep that in mind as well. All right, just making sure anybody had any questions here. Baclofen, the drug class for that is centrally act. I would even just settle for muscle relaxant on this one. It's used for spasticity. Um, Certain side effects may cause drowsiness, dizziness, and of course, avoid alcohol. Keep in mind with aspirin or most NSAIDs you either have to take with food or with milk. That you'll find that as the a note or a label on the prescription. Carisoprodol. So you might get what's the brand name for carisoprodol. Hopefully you'll remember that it is Soma. What's the drug class for Soma? Centrally acting muscle relaxant. Again, you could just put muscle relaxant. That's fine. That's probably what I'm going to have as an answer, anyways. Muscle relaxant. I won't put centrally acting. Um, Also, it's for musculoskeletal pain. So baclofen, just remember, it's for spasticity. Even though it's a muscle relaxant, this one's for spasticity. Carisoprodol, it's going to be for musculoskeletal pain. So just kind of remember that, even though they are both muscle relaxants. All right. Again, look at the list over here on this end. This one, again, is the same as this. May cause dizziness or drowsiness. Avoid alcohol. And then also this one, federal law prohibits the transfer of this drug to any person other than the patient. Usually you'll see this with a lot of narcotics, controlled medications, from control 2s to control 5s. Um, this was not a controlled, but it's a muscle relaxant, and it's pretty strong where it can say like you're taking a opioid and then you combine this, it could really suppress your breathing. So you don't want to mix them two together. You also got celecoxib. It's an NSAID. So what's the generic name for Celebrex, celecoxib? What's the indications for celecoxib? It's mainly for arthritis. So if you put arthritis or osteoarthritis or rheumatoid arthritis, I'll take either one of those. Again, I will have it's going to be multiple choice, so one of these will be the answer. Again, NSAIDs, take with food or milk. Take with food or milk. So just remember, all or most NSAIDs. See this one down here, NSAID, take with food or milk. All or most NSAIDs. Again, Tylenol is not an NSAID. Cyclobenzaprine, also known as is a muscle relaxant. So, drug class for cyclobenzaprine, muscle relaxant. Drug class for Flexeril, muscle relaxant. Generic name for Flexeril, cyclobenzaprine, or you need to know what's the brand name of cyclobenzaprine, which is Flexeril. Again, the muscle relaxant may cause dizziness or drowsiness. It's going to be, the same for most of them. And again, avoid alcohol. Another NSAID, diclofenac sodium. Brand name is known as Voltaren. What are the indications for? Again, this one's for usually for arthritis. So if I have have either arthritis or osteoarthritis on that, as far as the indications. And I may have what do you have to take with it, or what it what's the usually the rule for NSAIDs. So usually the rule for NSAIDs is to take with food or milk. All right, so we're jumping a little bit to an opioid, hydrocodone acetaminophen. Um, Brand name is either Lortab, Norco, Vicodin. So I'll say what's the generic name to Norco? What's the generic name to Vicodin? And you'll have to let me know that it is the hydrocodone with acetaminophen. What's the drug class? It's going to be an opioid, and the indications are for moderate to severe pain. And you'll see this familiar with most of the opioids. Um, may cause dizziness or drowsiness. Avoid alcohol. Um, you'll see, like I said, you've seen this on some of the muscle relaxants. So just don't get that mixed up with these opioids. And again, you have this caution right here. You cannot let anybody else use the controlled meds there. All right. Ibuprofen, we're all familiar with ibuprofen. Brand name is Motrin or Advil. Motrin or Advil. Um, Drug class for Motrin or ibuprofen is an NSAID. An NSAID again is stands for non-steroidal anti-inflammatory drug. Um, for the indications, I'll have a list there for you to choose from. I'll either have osteoarthritis, rheumatoid arthritis, or inflammation and fever here. Pain, inflammation, or fever. So I'll have one of those, and you'll have to pick the right one. Again, NSAIDs may cause dizziness or drowsiness. Take with well, the other ones didn't have may cause dizziness or drowsiness like this one. That one doesn't cause it, but ibuprofen does. For the most part, again, NSAIDs take with food. This one as well, take with food for Mobic. Generic name is meloxicam. And they kind of all fall in the same, as far as indications. Osteoarthritis is, for a rheumatoid arthritis or, some sort of arthritis type. This one does come in a suspension. So if you get it in suspension, it does come in tablet as well. But if you do get in suspension, shake suspension well before use. And again, with NSAIDs, always take with food. Take with, well, it's usually with food. This one's okay to take without food, but usually NSAIDs you should take with food. Just making sure y'all didn't have any questions. Methylcarbamol is another muscle relaxant. Brand name for that is Robaxin. Just remember, vice versa. What's the generic name for Robaxin? Methylcarbamol, and its indications are for muscle spasms and may cause dizziness or drowsiness. So muscle relaxant, again, yeah, they all kind of fall in the same way. May cause dizziness or drowsiness. This one doesn't say avoid alcohol, but I'm pretty sure that you need to avoid alcohol as well on this. But um, it's good to know the side effect on that. Some more opioids, morphine sulfate. I did not specify on hydrocodone. Is that just remember that it is a controlled 2. So you will see a C2 on that. Then again, C2s are not refillable. They need a new prescription to fill controlled 2 medications. So we're down to morphine sulfate. Morphine sulfate is usually given a lot in hospitals, more so. Usually whenever a person is in really severe pain or on hospice, they'll give them morphine or fentanyl. Just remember, brand name for morphine sulfate is MS Contin, and the generic name for MS Contin is morphine sulfate. Drug class for each one is going to be opioid. It's for severe chronic pain, and keep in mind, may cause dizziness or drowsiness, just like the muscle relaxant. Just like the muscle relaxant, avoid alcohol, um, as well as Tylenol as well. But since it's a controlled med, only one person is able to take it. You cannot share this, of course. Another NSAID, brand name's Naproxen. Um, Generic name is naproxen. Also, the brand name would be Aleve as well for naproxen. Um, those are both NSAIDs. Since this is the only one on here, I will just like ask you what's the generic name to naproxen, or what's the brand name to naproxen, or what's the drug class to naproxen, or something like that. So you would put NSAID, and it says may cause dizziness or drowsiness. Again, NSAID does do that. And this one you do take with food or milk. Another opioid, OxyContin, oxycodone. Just become familiar with those, the generic and the brand name. Drug class is an opioid. It's for severe chronic pain. And here it states it's repetitive there. May cause dizziness or drowsiness. Avoid alcohol. And of course, this is only for the patient that it is prescribed to. So here's the other ones, more on opioids. This one's a little different, but this is a muscle relaxant. It's just an alpha 2 agonist, though, and we'll talk about the difference between that one, the two muscle relaxants. Again, may cause dizziness or drowsiness, or avoid alcohol. And they want you to avoid alcohol because it does suppress the lungs. So I mean, this is how people overdose, and you know, some. I mean, there's a lot of rappers like uh, what's his name, Mac Miller, passed away, but they didn't know how strong these medications were, and they ended up overdosing over them. Um, King Little P, I can't think of his name. Okay, but anyways, they've all overdosed on opioids, some type of opioid, and a combination of something else. Tramadol. Tramadol was just recently changed. They put that, I believe it's a schedule. Have to look back at it. I don't know if it's a schedule 2 or not, but it is considered an opioid. Just remember, brand name for tramadol is Ultram. And the way to remember that is the TRAM, tramadol, Ultram. It's for moderate to severe pain. Tramadol can be taken with or without food, but take it the same way each time. Swallow the capsule or tablet whole to avoid exposure to a potentially fatal overdose. Do not crush, chew, break, break open, or dissolve. Um, Fatal side effects can occur if you use tramadol with alcohol, or with other drugs that cause drowsiness or slow your breathing. So again, it affects the breathing. And again, since it's a controlled, only that one person prescribed should take it. So what we have: 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. So 16 medications on this one. Remember the brand name, remember the drug class to each, indications. And, it becomes repetitive. So, like, kind of put those together like NSAIDs. NSAIDs usually are for pain, inflammation, and fever. usually are for osteoarthritis or some type of arthritis. Whereas with the acetaminophen, it's just mainly for mild pain and fever. And it is an analgesic. So, don't put acetaminophen in the NSAID section. And that's what because a lot of students do that. Again, your alendronate and biphosphonate. Get familiar with that. So, I will have a Quizlet on this one. You're able to do a matching or maybe a practice test. I think, only lets you do a test one time or something. So it does help out uh, as far as the study process. Any questions on studying the medications? Y'all both good with that? All right, good. All right, so let's get into the readings on chapter 19 here. Let me close this and open up the PowerPoint. And I'm also going to open the book up as well here. Let's see. So chapter 19 starts on page 424 in the book. And it does give you the list there as well on page 425 as to what the brand and generic name are and how to pronounce them if you want to pronounce them. And it does separate them uh, in drug classes as if you look on page 425. I know you can't see it yet, Skylar, but I'll show you when you come in today. But it separates them into drug classes. So this is another, it can help you out as far as keep them separated as to what drug class it falls into. Um, see where this starts here. So these are therapeutic agents for the musculoskeletal system. So we're dealing with pain, we're dealing with arthritis, we're dealing with muscle uh, spasms, stuff like that. Learning objectives describe the major components of the musculoskeletal system. List the primary symptoms of conditions associated with the musculoskeletal system. In addition, recognize drugs used to treat the condition associated with the musculoskeletal system. Write the generic and trade names for the drugs discussed in this chapter and list appropriate auxiliary labels when filling prescriptions for medicine discussed in this chapter. I'm not too focused on the anatomy and physiology, other than you just need to know that it's dealing with the skeletal system, muscles, tendons, ligaments, and bones. It's pretty easy to remember. Um, Bone marrow, blood cells are produced here, storage banks for minerals, calcium, phosphorus, important in the bodily functions. Two types of bone are compact and spongy, but for the most part, just dealing with the muscles, tendons, ligaments, bones, stuff like that. Anatomy and physiology. So certain types of muscles you have are skeletal muscle, cardiac muscle, and smooth muscle. If you've taken anatomy already, I don't know if y'all have or not, but y'all will get more in depth on all that. My main focus is that I want you to put together the body system we're dealing with. So we're dealing with the musculoskeletal system. That's the body system, and the different types of medications for that specific body system. Just put those two together. Let's go down here. So osteoarthritis. So this is a type of disease here. Common form of joint disease. Loss of normal cushioning. So it's a wear and tear on the bones. Usually affects the knees, hips, spine, hands, and feet. There's no cure for osteoarthritis. So if you see an abbreviation OA, remember that that stands for osteoarthritis. So when we get to chapter 5, you'll see a lot of abbreviations, but start to get familiar with different types of abbreviations that you see here. But slowing the disease is possible. Treatment for osteoarthritis, occupational and physical therapy, regular exercise, weight loss. Some people take acetaminophen. APAP is short for acetaminophen. Again, it's an analgesic and antipyretic. For the most part, it's just for fever and pain. That's it. No inflammation. NSAIDs, which are non-steroidal anti-inflammatory drugs. That is the one that's for inflammation. That's for specifically targets osteoarthritis. It specifically targets arthritis and inflammation. So just don't get those two mixed up. And then you also have steroid injections for arthritis as well. So starting off with acetaminophen, it's an analgesic and an antipyretic. Does not have a peripheral anti-inflammatory, so it doesn't help with inflammation or inhibitory effects on platelet functions. So it's not going to deal with any kind of inflammation. Misuse of this is the most common cause of liver failure. So if you're overdoing it on Tylenol, generic name acetaminophen, more than likely your liver is going to get shot. And also, I mean, this is not the only one that affects the liver. Um, if you take high amounts of NSAIDs, ibuprofen, Aleve, that also affects the liver as well. Most cases of misuse are unintentional. Now we got aspirin, which is a salicylate, um, discovered from a bark of a willow tree. It was marketed by Bayer in 1899. Bayer, for the most part, was first started off as um, making what was called Agent Orange um, during the war back in the 1800s, early 1900s, I'm sorry. And this actually was used during Vietnam, using Agent Orange, and it affected a lot of the soldiers and their kids as well. The soldiers were affected, and for some reason some of the children of the soldiers were affected as well after coming back. Some had were the missing, of course, the one chromosome um, and stuff like that. So they were. It was pretty bad for them to use that during the war, as far as Vietnam and whatnot, because it did cause some type of injury towards the kids or whatnot, and on the soldiers. But they did find that it did cure some form of or ate up some form of the cancer uh, to it. So that's how they kind of started dealing with medications and stuff like that. And one of the first types of medications was aspirin, was to treat pain, fever, and inflammation. So this is a NSAID. It shouldn't be given to children. Too much of it can cause Ray syndrome associated with this. Um, Ray syndrome. Let's look at that real quick. The exact cause of Reyes syndrome is unknown, but it commonly affects children and young adults recovering from viral infection, for example, a cold, flu, or chickenpox. In most cases, aspirin has been used to treat their symptoms, so aspirin may trigger Reyes syndrome. So aspirin may trigger Reyes syndrome. So just you don't want to give the children uh, any of that. All right. Again, with NSAIDs or non-steroidal anti-inflammatory drugs, um, it's a close structure to aspirin. Um, it suppresses inflammation, so it's dealing with inflammation by inhibiting cyclooxygenase or COX enzymes. So you have a COX-1 and COX-2 enzyme. COX-1 promotes platelet aggregation and metabolic function. So it helps with platelets coming together and the metabolic function of the platelets. Also, COX-2 works at the site of the tissue injury. I believe celecoxib. Let me look at that one. So we're already on page 430 in the book, and I'm looking to see about celecoxib. Wait. All right, so we're on 434 actually, talking about celecoxib. So you got cyclooxygenase 2 inhibitors. I'm just going to read over that on page 434 at the top. Earlier, we noticed cyclooxygenase has COX-1 and COX-2 forms. First generation NSAIDs inhibit both COX-1 and COX-2 enzymes, which decreases inflammation, pain, and fever. Inhibition of COX-1 enzymes has serious side effects, including gastric ulceration, bleeding, and renal damage. The theory behind COX-2 selective inhibitors is that they could treat pain and inflammation without the risk of non-selective agents that also inhibit COX-1. However, in practice, selective COX-2 inhibition has not reduced NSAID-related side effects as expected. Manufacturers withdrew rofecoxib, which is Vioxx, and valdecoxib, which was Bextra. Both were COX-2 inhibitors from the market. There were safety concerns about cardiovascular events. So they found that they had serious side effects as far as the Bextra and the Vioxx that developed cardiovascular events. So they took that off the market. So they would have to have either a class 1 or class 2 recall. Just going over what we went over in chapter 2 on as far as rules, as far as recalls. There were safety concerns about cardiovascular events. Now, healthcare providers reserve COX-2 inhibitors for patients intolerant of traditional NSAIDs. So if the patient cannot take the regular ibuprofen or the Aleve, then they'll move them to a celecoxib or Celebrex. Celecoxib or Celebrex is the only COX-2 inhibitor approved for use in the United States. So looking at celecoxib, brand name is Celebrex, mainly used for osteoarthritis or rheumatoid arthritis. And some side effects it shows here are nausea, abdominal pain, and cardiovascular events. So it still kind of has that big side effect of cardiovascular events. But this is the only one that's approved in the United States. Again, with this one, you have to take with food or milk. So that was a kind of a special NSAID for celecoxib or Celebrex. Some common NSAIDs, naproxen, which is either Aleve or naproxen. Naproxen is more of a prescription, where Aleve you can get over the counter. That's specified in on page 434 in the book. Um, and it should be taken with food to avoid stomach irritation. So again, most NSAIDs you have to take with food or milk. Back down to cyclooxygenase 2 inhibitors. There's two forms. Again, there's the COX-1 and COX-2. Side effects of inhibiting COX-1 you'll get gastric ulcers, bleeding, and renal damage. Those are types of side effects for COX-1 inhibitors. COX-2 inhibitors, COX-2 inhibition does not reduce NSAID side effects. So it does not reduce the side effects to what NSAIDs might cause, which sometimes may cause dizziness or drowsiness. So it doesn't reduce that. All right, on to some topical over-the-counter pain relievers, which can help manage osteoarthritis and muscle strains. Patients widely use products containing menthol and methyl salicylate. Again, if you see salicylate, it has a form of aspirin. Um, so again, menthol, you're dealing with Bengay or icy hot. Aspirin cream has trolamine salicylate, and the Tiger Balm has camphor plus a menthol. So the menthol, you'll see that a lot on topicals. That's what gives that warm feeling when you apply it. Gives that warm feeling and keeps it, warm and heated. Very important, opioid analgesics. I'll probably read up on this as well, starting on page 434 in the book. Mechanism of action, act on opioid receptors in the brain. So it's going to act and treat the receptors that are for pain, that alleviate pain. Changes perception of pain at the central nervous system. CNS means central nervous system, and spinal cord level. So it changes the receptors, helps out with pain. Morphine is a prototypical opioid agent. Schedule 2, all opioids are mainly Schedule 2. Have to look at tramadol, see where that one's at. But all or most opioids are Schedule 2, which cannot be refilled at all, unless, they cannot be refilled at all. And they all cause sedation and respiratory depression. Like I said, there's plenty of rappers, singers that have, even Prince, I think he had a fentanyl addiction, and he overdosed with that, too much of it, suppressed his breathing. Osteoporosis is systemic skeletal disease. So I kind of went over this already in human diseases. Low bone mass and deterioration. Danger. Well, I'm sorry. Let's go back. Let me read back on opioid analgesics real quick. That's what I told you I was going to do. Opioid analgesics play a pivotal role in pain management through actions on the brain's opioid receptors. The three main opioid receptor types are mu, kappa, and delta receptors. Not anything that you really need to know. Just deals with pain, suppresses that pain receptor. Analgesia mediates through changes in pain perception at the spinal cord level of the central nervous system, which shows in figure 19.9. Clinically effective opioids work as mu receptor agonists. Most consider morphine the prototypical opioid pain medication. Activation of mood receptors produces analgesia, meiosis, which is pupillary construction, respiratory depression, euphoria, decreased GI motility, and physical dependence. So I don't know if you've seen some TikToks where the parents film their kids on high off some type of opioid in the dentist office, and the kid is just talking out of his mind. Doesn't know really what they're saying. That's what opioids does if you take like a real potent amount of it. Opioid medications are controlled substances. The U.S. Drug Enforcement Administration, or DEA, schedule depends on the agent and formulation. Because opioid prescriptions cause sedation and respiratory depression, and the overdose may be potentially life-threatening. Opioid antagonists, such as naloxone and naltrexone, can reverse opioid agonist effects by competing for opioid receptor sites. Provides an overview of select opioid agonists and antagonists. So I don't know if y'all have gone over this in classes, but now a lot of schools are um, keeping naloxone um, for opioid overdoses, and they have been educating as well. So let me write that down. Naloxone reverses the effects of opioids. So if somebody's overdosing, they'll either give that either through the nose or they'll inject it. Most of the time, it'll be inhaled through the nose, and they'll come back from it. Let me show a quick video over that real quick. No, because there's cops that have overdosed on it just by touching it. I don't know if y'all seen this one, but it was pretty scary, actually. That's what they locked. Just touch, he just touched it. They just touched it. Started overdosing. So Narcan, that's the brand name to naloxone, which brought him back. But he kept on overdosing, so they had to give him more than they. I think they had like gave him four of the shot hits of that Narcan to bring him back. But just by touching the medication, he started overdosing, which was very very scary. So that's why they say one pill can kill, because you don't know how strong that pill is, how potent that pill is. All right. There was one more I wanted to see here. This one right here. He also started overdosing. She probably touched it. She's getting naloxone. So yeah, she's already. She can't breathe. Probably have to give her another hit of that. All right. So those are the types of effects. So whenever you hear about counter action or counter effect of medication. So when you see two drugs that counteract with each other, that's what that means. So you have fentanyl, naloxone counteracts. Those two medications counteract. They work against each other. So fentanyl, if you have too much of it, you take a hit of that naloxone. It'll counteract with the reverse the effects of fentanyl, and hopefully you're able to come back from that, and you weren't didn't either ingest or touch a real potent amount of it. So um, just thought I'd show you all that. Very important stuff there. As far as opioids, just remember hydrocodone with acetaminophen, which is a brand name Vicodin or Lortab. You have oxycodones, which is the brand name Roxycodone. So they kind of sounds the same. So kind of put those together, in as far as memorization. It says on the tech note on page 435 in your book, for combination opioid medications with acetaminophen, it is the acetaminophen that limits the maximum daily amount. So 3,000 milligrams per day. So the max for just Tylenol is 3,000 milligrams per day. Some individuals with liver diseases may require smaller daily amounts, usually about 2,000 milligrams per day. So again, other opioids are fentanyl, and then on page 435, it does list different types of brand name fentanyl, Duragesic, Ventura, Oncelis, Actique, Lysandra, Abstral, and Subsys. I'm probably just gonna put that together with Duragesic, fentanyl, brand name Duragesic. So you don't have to really remember like Ventura, Oncelis, Actique. You don't have to remember any of those. Just Duragesic. Um, and most opioids, as far as side effects, cause dizziness, drowsiness, suppress breathing, avoid alcohol, and of course, federal law prohibits the transfer of this drug to any persons other than the patient for whom it was prescribed. Osteoporosis, systemic skeletal disease, low bone mass and deterioration. You find this a lot in older females. Danger is bone fracture. A lot of the older generation um, has hip fractures, which often lead to their demise as well. Um, and it affects postmenopausal women for the most part. Osteoporosis management and treatment. So when you have osteoporosis, you have loss of calcium from the bones, resulting in bones that become brittle and fracture or break easily. Prevention of osteoporosis must be started early in life. So you either have to have lifestyle changes, exercise, diet, and smoking cessation, stop smoking. Exercise helps. Drinking or having vitamins such as calcium helps. Either vitamin D from the sun or from vitamins helps as well. They all increase bone density. Osteoporosis management treatment again, new studies. 15 minutes of direct sunlight twice weekly supplies enough vitamin D for the body. Multivitamins act as a replacement for the sun. So if you don't get that much sun, say you live in Alaska or something, don't get that much sun, they'll take vitamins. Long-term use of corticosteroids, like medroxyprogesterone, give off excessive thyroid hormones, which promote osteoporosis. So if you take long-term use of these type of corticosteroids, so um, a lot of people take steroids for either to stop for like whenever they're sick. They want to stop coughing. It's a nagging cough. So sometimes they'll give them some corticosteroids, which actually makes them feel better. But if they do that on a regular basis, then they'll affect their thyroid hormones, which pushes more osteoporosis on the body. So dealing with osteoporosis, again, NSAIDs are um, a form of treatment of osteoporosis. Also, don't forget the biphosphonate alendronate. Alendronate is for severe osteoporosis. Again, with alendronate, you cannot lie down after taking it for 30 minutes because it affects the esophagus. And take it with a large glass of water for as far as alendronate or Fosamax. Again, NSAIDs you have to take either with food or milk. Jump into gout, another disease that affects us as we get older. So arthritis that occurs when uric acid builds in the blood. This often happens in the like the big toe for males, the big toe area. Also in like your elbows, some knees. But for the most part, you can really feel it in the big toe. Uric acid crystals in joints lead to inflammation and pain. Acute attacks usually affects a single joint. Treatment, weight loss, abstaining from alcohol, diets low in beef, lamb, and pork. Some drug treatments for gout are colchicine NSAIDs, and corticosteroids. For the most part, they use allopurinol. Let me see if I can find that one. See if I can find that. So looking on page page 441, it gives you some types of treatments for gout. So you can use NSAIDs, some ibuprofen, Aleve, or also indomethacin for gout. For severe gout, you probably want to go a little bit stronger as far as medication. So you have anti-gout agents, colchicine. You have some corticosteroids, which prednisone, triamcinolone, and methylprednisolone also help with gout. As I was saying, allopurinol, brand name Xyloprim, helps with gout, and probenecid also helps with the crystallization, dealing with gout. For the most part, these other drugs weren't like your prednisone, triamcinolone, methylprednisolone here on page 441. Not you'll learn all those corticosteroids later, so it's not anything you have to remember. What I really want y'all to remember is the list that I gave you that I just went over at the beginning of class. That's the ones that I want y'all to remember. On to skeletal muscle relaxants. And this is dealing with spasticity, um, muscle pain, muscle spasms, stuff like that. So used in injuries to musculoskeletal system, severe or chronic pain may require more care. Some drug therapies are analgesics, muscle relaxers, and physical therapy. I'm going to read a little bit on skeletal muscle relaxants. Starting on page 441. Skeletal muscular pain can arise from many causes. Although everyone experiences some distress at one time or another, severe injury or chronic pain may need extra care. Treatments include drug therapies, again, analgesics and muscle relaxers, and physical therapy for severe injuries. Surgery may be an alternative in medication, and physical therapy prove ineffective in preserving the quality of life and functionality. Prescribers can use skeletal muscle relaxants for musculoskeletal injuries. These medicines reduce muscle tone. So, you look at 19.5, gives you some types of musculoskeletal medications. I believe most of these were in the list that I gave you, though. So make sure you do look over those. Again, common side effects are dizziness, drowsiness, also dry mouth and fatigue. It does get you really drowsy. So you don't want to be driving a car long distance. Tech note, it says, studies have shown that pharmacokinetics of tizanidine, tizanidine is a muscle relaxant, capsule and tablets vary enough to cause differences in efficacy and side effects if the patient changes dosage forms. Okay, so we have two different types of dosage forms on with tizanidine. You have a capsule and you have a tablet, and they cause different efficacies. They work on the body different, it seems like. Healthcare providers should caution patients about potential gaps in clinical outcomes if they switch from one dosage form to another. And again, we'll go over a lot of the dosage forms, um, chapter 5. All right. Neuromuscular blockers. I think this is the last one. They are used with anesthetics in surgery. So usually we'll see these or see this in hospitals. They relax skeletal muscles to induce paralysis. So this is like what they gave Michael Jackson. It was known as propofol. Brand name is Diprovan, and it looks like a milk. It looks like a milk in a bottle. It's that color. It's real white, like milk. And they gave a little bit too much to Michael Jackson, and he overdosed on it and died from it. So these are the types of medications they gave him. So this is a neuromuscular blocker. It again it induces paralysis so that you're not waking up during surgery. You have two categories. You have depolarizing and non-depolarizing. Depolarizing. Some examples are succinylcholine. Again, it deals with paralysis. And then you got your non-depolarizing, which are block receptor activation, which prevents transmission of impulses. Let's see if it gives you anything else. So let me read a little bit on neuromuscular blockers. Surgeons will use neuromuscular blocking agents with anesthetics for surgery. So this is anesthesia. Neuromuscular blockers relax skeletal muscles to induce paralysis. Uh, this really suppresses the breathing. They help to place the patient on a ventilator and to suppress the patient's spontaneous breathing after a ventilator is in place. We divide the agents into two major categories: depolarizing and non-depolarizing neuromuscular blockers. Depolarizing agents such as succinylcholine mimic the effects of the neurotransmitter and acetylcholine. By mimicking acetylcholine, succinylcholine competes with acetylcholine for the cholinergic receptors to cause prolonged depolarization. Succinylcholine prolongs depolarization because acetylcholinesterase cannot rapidly degrade succinylcholine. This prolonged depolarization results in skeletal muscle paralysis. So it just keeps you from moving. And that's a depolarizing agent. So succinylcholine, depolarizing agent. These other ones are non-depolarizing agents. Also shown on page 443 in your book, you got atracurium, cystocurium, pancuronium, rocuronium, and becuronium. They all kind of almost in the same: atracurium, cystocurium, pacuronium, rocuronium, and vecuronium sound in the same suffix. So kind of put that together with your neuromuscular blocking agents. Non-depolarizing agents also compete with acetylcholine, but lack agonist activity as receptors. Instead, non-depolarizing agents block receptor activation by acetylcholine and prevent impulse transmission, leading to muscle relaxation. The neuromuscular blocker used depends on needed anesthetic duration, which is shown in 19.6. Additional smaller doses are prolonged or can prolong the blocking agent's action. Pharmacy technicians may be responsible for filling floor stock orders for these medications for the operating room. We do fill these prescriptions in the hospital. So if you do get a job at the hospital, you'll see a lot of this stuff. Tech alert. Remember the following sound alike, look alike drugs: lindronate, resindronate, ibandronate. Those Let's look back on page. Well, just become familiar with those different types. Again, look-alike, sound-alike will have tall man lettering um, to distinguish the difference, and also um, the look-alike, sound-alike. I mean, they'll have different lettering uh, where it's easier to differentiate the different medications that may look alike or sound alike. So just remember, just because, like I said, there's some suffixes that will lead us to a drug class, but there are some exceptions. There there are some exceptions to the rule of that. All right. So that's the end of chapter 19 in a nutshell. Do y'all have any questions in regards to chapter 19? Any questions at all? All right. Um, let's see. Go back over here. Close this. Again, your list. I'm just going to be going by this list here that I have in your homework page for y'all to remember. So just don't look at any further as for any different words. I'm just going to be pulling from this list here as far as testing. All right. So we will have a quiz over this next week sometime. Look again. Go over your matching for your homework. Do your matching. True, false. You don't have to do the system identifier. You don't have to do this part right here. That's more. This is more anatomy, physiology. We're not we're not focused on that. I just want, again, we're dealing with musculoskeletal. That's the main thing that I want y'all to put together. This is dealing with musculoskeletal system. All right. But do the multiple choice. You'll have to do the multiple choice. And here's some more matching. And looks like that's the last of that one. Again, they're not numbered in sequence, in chronological order, because it wouldn't let me um, make copies in that way. I don't know why, but the even numbers are on this one here. We don't have to mess with any part of, you don't have to mess with any of this. I think this is from the last chapter, or yeah, chapter 18. So you don't have to mess with this. You don't have to mess with this. You do have to fill in the blanks. And don't forget your matching here on this side here, as far as medications, matching which brand name goes to the generic name. So Motrin, what would Motrin be for this one? Anybody got any guesses? What's the generic name to Motrin? Or look back in your book if you have it, if you have one. So generic name to Motrin is ibuprofen. That's also a leave. So again, you'll put C here. So do that. We'll go over short answer together. probably tomorrow. And let's look at the labs, see what labs I want y'all to do. So do labs 19.3, 19.4. So on page 286 and 290, let's go back. Let's see. I'm sure this is probably 19.3. Let me go back. All right, so this is talking, okay, so 19.3, it's dealing with the neuromuscular blockers. So you'll find a lot of these answers on page 19.6. I mean, page 442 and page 443 for this one. Generic name for a nectine is succinylcholine. I'm not gonna be too. I'm not gonna have y'all do the storage requirements. Y'all don't need to do that, or y'all don't need to do the expiration date as well. I just want to know that you're putting the correct generic name to the brand name to this. So just fill in the generic name on this one. And 19.4, all right, because we did a little overview on DAW, which means dispense as written. So you look at these where it says DAW0, it says no product selection indicated. So that's telling us as a pharmacy technician, it is okay to dispense generic. All right, it's okay. So if you get a DAW1, okay. So on the bottom of the bottom of the prescription, it'll have a DAW. It'll have one, two, oh, it'll have a 0, 1, 2, 3. I guess we'll go for it. And the doctor will circle one of them. So say he circles one. So that means that substitution is not allowed by the provider. So that means that the doctor wants the patient to take the brand name. So as a technician, that's telling me brand name only on this one. DAW2 stands for or is for substitution allowed, but the patient is requesting the product dispense. So the patient is requesting like a brand name, doesn't want the cheaper generic formula because they might think it don't work as good for them. So they want the brand name to the medication. So then the prescriber would circle DAW2 or fill in DAW2. DAW3 substitution allowed, but the pharmacist selected the product dispensed. So maybe the pharmacy did not have that certain drug. So the pharmacist picked a drug that's equivalent to that, whether it's a brand name or generic. And of course, the pharmacist has to call the doctor just to make sure that it is okay to dispense before uh, issuing it out, because you kind of change the medication as well. DAW4, again, substitution is allowed, but the generic drug is not in stock. So the generic drug is not in stock, so we had to dispense the brand name drug on that. DAW5 substitution allowed. Brand drug dispense as generic. So, say we didn't have the generic, um, so we would change that to a DAW5 and run the insurance as a generic pricing, but we're using a brand drug formula. And DAW6 is for override, and that's mainly for insurance purposes and whatnot. So let's then you got 7, 8, and 9. Substitution not allowed. Brand drug mandated by law. Or DW8. Substitution allowed. Generic drug not available in the marketplace. So it could be on back order or something. And then other would be DAW9. All right, let's look at number 1, RX. Let's how much will be dispensed? By looking at that prescription here, could y'all answer what will be dispensed? Or how much will be dispensed? Can y'all answer that? So this one right here, this pound 30, is telling me the quantity to be dispensed. So we would put 30 right here. So how many days will the medication last? So this is telling us 1 tab. PO means by mouth. QD means every day. 1 tab, PO by mouth every day. So if I take 1 tablet by mouth every day, how many days is that going to last me? Can you answer that? 30 is correct. Take it 1 time a day. Have a quantity of 30, should last us 30 days. How many refills are permitted in the prescription? So when we see REF, that means refills, short for refills. So it shows that we have 0 refills. And it's okay, this is what the lab is really stressing on. DAW, which means dispense as written. What is the dispense as written code that we will use? So it doesn't specify DAW 1, 2, 3, 4, 5, 6, or 7, 8, or 9. So when it doesn't specify, we're going to go automatically to DAW 0. So right here, it's going to be 0. All right. All right. Let's look at one that does have DAW. Let's look at number 4 here. So by looking at this, how much will be dispensed? So what's the quantity? How much are we going to dispense? Anybody? Anybody give me an answer? How much are we going to give? Yeah, quantity of 42. And how many days will the medication last? So this is telling me 1 tablet, PO again means by mouth. This Q8H means Q means every, 8 means well the number 8. H is going to mean hour. So 1 tablet by mouth every 8 hours. So if we take it every 8 hours, how many days is that going to last? How many times a day is that to take? Let's answer that. How many times a day is that? Every 8 hours. So there's 24 hours in a day. We divide that by 8. We should get 3 times a day. Just wait for Mo to send hers. Okay. So it should be 3 times a day. So what's the how many days will that last if we're taking this medication 3 times a day? Any guesses? 42 divided by 3 is 14 days, correct. So basically, we're just going to divide 42 divided by 3 because the patient is taking it 3 times a day. So you do get 14 days. How many refills? Anybody? None. Yes, that is correct. And so Part D, let me see. Part D is on the other page. So Part D is going to ask what is a DAW code that will be used for this one. So what's the which number of the DAW code states brand name medically necessary? So we'll go back up here and see which one's brand name medically necessary. It's usually going to be DAW1. So DAW1 is, it may not say it, but it's selecting brand name. So substitution not allowed by the provider. So we would put number one where it says what DAW code will be used on letter D here on number 4. We'll put DAW1 on that. Let's see if there's another one. Let's look at number 8. So what's the quantity that should be dispensed? 15. All right. So the directions on this one are take 1 tablet by mouth. TID. TID is going to stand for 3 times a day. So if we're taking this medication 3 times a day, how many days is this gonna last? 5, correct. How many refills? 0. Okay, so the DAW code, so it's stating patient requested brand. So for DAW, we go up here, patient requested brand, patient requested product dispense. So we would put DAW2 over here on number 8, DAW2. Says write directions as they would appear on the medication label. Um, take 1 tablet PO by mouth, which is by mouth. TID means 3 times a day. So you would put take 1 tablet by mouth 3 times a day. And if you look in like the side effects or the auxiliary label part for ibuprofen or Motrin, you should be able to find what types of auxiliary labels to use. They're in on the sheet that I have on your list. They're on that sheet. And also, again, with the NSAIDs, what do we always um, pretty much have to take with that? Anybody remember? What do we have to take with the NSAIDs? Or how do we take it? Take with food and or yeah, food or water, yeah, or milk. I'm sorry, food or milk. All right, all right. Let's see what else I got for you guys. So here's your list of meds you can reference back to. Um, go here real quick. I am not put in the Quizlet for chapter 19, but I will. Chapter 19. Agents, musculoskeletal. Pulls up this Quizlet here, and again, it gives you a good study session as to what to look for. This helps you out as it also helps you out on your worksheets. So I'd use that to my advantage. Um, do the matching, and see what goes with what. So let's see if we can answer some of these. So here's an answer. There is an answer. All right. So what is the classification for soma? What is the classification for soma? What would that fall into? Any guesses? Or y'all could look on for those who have their book. Nope, it's not gonna be the cyclooxygenase. That's actually should be where's it at? Skeletal muscle relaxant. Soma. Drug therapies for what include colchicine, NSAIDs, and corticosteroids. What would that be? What would this one be? Drug therapies for what include colchicine, NSAIDs, and corticosteroids. Any guesses? These are your guesses right here. Which of those is the answer? So this one's actually going to be gout. True or false? Which you only have one answer here. Weight loss, abstaining from alcohol, and adopting a low purine diet can be particularly beneficial for those with gout. Of course, that's going to be true. Let's look at this one. Opioid analgesics cause each of the following side effects, except which one? Kind of gives you the answer there already. Diarrhea. What is a selective estrogen receptor modulators for osteoporosis? And again, this only gives you this answer here, so you kind of gets kind of easy there. Either of the two related enzymes that control prostaglandin production, just cyclooxygenase. And just keep on doing those. I mean, those help out quite a bit as far as study sessions. You could do that one. Let's go back. Go through your index cards, even take a test on it. You can only take it once unless you sign up for it. If you sign up for it, that'd be great too. You could take it more than once. Also, your Q chat. I like getting into the quiz part. What is Reyes syndrome? Just put musculoskeletal disease. See what it tells me. I guess I got it right because then tell me otherwise. What is a pharmacologic treatment of osteoarthritis? Um, let's put NSAIDs. See what it says. Maximum daily dose of acetaminophen, I believe, 3,000 milligrams. So it's actually 4,000 milligrams for the max dose. So I guess I was correct on the other ones. What is the trade name for naloxone? Anybody remember the trade name for naloxone? Brand name? Brand name is trade name, which is Narcan. So, just go over these and try to answer them, as best as you can. It does follow up and give you kind of hints and whatnot. So give me a hint. ROA for hydrocodone acetaminophen is a common and easy method of administration. What is ROA? Route. ROA for hydrocodone of acetaminophen. ROA means route of administration. Uh, I would say the common route of administration is oral. So it tells you, lets you know that you're correct or not. What is the mechanism of action of hydrocodone? So severe pain. Okay, so can you please answer the question? What is the mechanism of action? Let's see what gives us a hint. Give you a hint. Let's put I don't know. So the mechanism of action of hydrocodone is that the hydrocodone activates opioid receptors, while acetaminophen inhibits COX-1 and COX-2. So it keeps on asking you questions. So I would go through these just, on a regular basis. 20, 30 minutes a day helps you out. And that's for each of the chapters. Any questions? Any questions at all? No questions? Okay. All right. So at this point, we should be getting already done with chapter 2 for those who have been here, of course. Skylar will catch you up real quick so we can have you ready to be getting tested and everything else. Good time for you to come in. You let me know, Skylar, what a good time for you, or when can you come in? Round 1. Okay, that'll work for me. Um, for the remainder, start finishing up or getting done with chapter 2. Skylar, when you come in, we'll get you all caught up. And what else? For those who have been here, test tomorrow, chapter 1. Chapter 16 will have a test on Wednesday. End of day, towards the end of the day, we'll do a quick review if we need to, just to help y'all out. I think that's about it for right now. I'm gonna let y'all, like I usually do, let y'all work for the last hour and 15 minutes, and we will get back together at 1 o'clock today, and we'll have to start get through chapter 3. We'll start up chapter 3. I don't want to bombard y'all with so many medications all at once. But if y'all don't have any questions, we will get back together at 1 o'clock promptly. About 1 o'clock, I'll start up again. We'll start up on chapter 3 uh, and go from there. All right. All right. Y'all have a great lunch, and we'll get back together at 1 o'clock. Everything sound good? All right. Y'all have a good one.